everyone, my name is Shrishti Sharma. I'm a board certified preventive medicine physician and I'm currently training to be a clinical informatician. In 2025, I, as a physician, would like to help you understand your health better, but also as a clinical informatician, I would like to help you understand data, healthcare technology, including artificial intelligence, as it applies to the healthcare space better. So let's go ahead and do this. There's so many things we can talk about as far as healthcare is concerned, but why don't we start by answering some of your most Googled questions in 2024. You wanted to know if bronchitis or pneumonia were contagious. Bronchitis and pneumonia by themselves are not contagious. Bronchitis is simply the inflammation of bronchus, which is the passage that goes to the lungs, whereas pneumonia is the inflammation of the lungs themselves. And it doesn't have to be the whole lung, it could be areas of the lung. What could be contagious, however, is what causes these inflammations. Sometimes these inflammations are caused by viruses, bacteria, fungus, and in that case, if the conditions are right, that is, if you're around a person who has the infection, if your immune system is not strong enough, or if you are exposed in any manner to these bacteria or viruses, then you could have that inflammation in your bronchus and your lungs, in which case it could look like that bronchitis and pneumonia are contagious. The next thing you wanted to know was, what is lupus? Your body has the ability to fight infections using the immune system. Sometimes, however, the immune system can attack the cells of your own body. When that happens, it is called an autoimmune disorder. Lupus is an autoimmune disorder in which the body fights against its own cells, causing inflammation in different parts of the body, right from your eyes to your skin to your internal organs to essentially anywhere else in the body. One thing to remember is lupus is not contagious. That is, it cannot go from one person to another. It could be hereditary in some cases, but it is not something that can be transferred from one person to another through contact or through exposure. There are different medications that can help with the symptoms of lupus. So if you think you or your loved one has lupus, go ahead and visit your physician who will be able to help you live your best self. The next question is something that we all think about. How much water should I drink in a day? Now that's a tough one. You may have heard that you need to drink 6 to 8 glasses of water every day, and that's generally a good rule of thumb. But remember, your fluid sources can be sources other than water. So you're drinking beverages, tea, coffee, fluid in your food. Say, for instance, you're eating a lot of watermelon. That could also count as fluid sources. In general, the way I like to think of it is, if you're not thirsty all the time and your urine is light yellow color or colorless, then it means you are getting adequate fluid. The next one you wanted to know is if strep throat is contagious. Strep throat, also known as streptococcal pharyngitis, is highly contagious. You are the most contagious in the first 48 hours of your symptoms or before you start taking antibiotics. If you have friends or family who have strep throat, it is wise to stay away. How long does a flu last? Typically, a flu can last anywhere between 4 to 7 days. The first 3 days of flu are usually the toughest, in which you may have fever, cough, sore throat, and you may generally feel pretty terrible. Day 4 onwards, you may start feeling better, but some of the symptoms would still remain. Day 7, most of your symptoms should be gone, but sometimes you could have a lingering cough. What causes hypertension or high blood pressure? There is no simple answer, but I will try. Primary hypertension or essential hypertension is when your blood pressure is high because of inherent factors. This could be because of your advanced age, because of obesity, because of family history, because of a long-term consumption of high sodium diet like excessive salt in your food, excessive alcohol consumption, insufficient sleep for whatever reason, or general social determinants. You're in a stressful environment for a long time, you've been exposed to air pollution for a long time, you've been exposed to noise pollution for a long time. Essentially, anything that increases the body's stress response for a very long time can lead to essential hypertension or primary hypertension. Secondary hypertension is when you get high blood pressure secondary to something else. It could be a disease like obstructive sleep apnea, certain thyroid diseases, or certain endocrine diseases, disorders in your blood vessels, um, uh, disorders in your kidneys. All of this could cause secondary hypertension. Secondary hypertension can also be because of some of the medications that you're taking. You could be taking some nasal decongestants that are known to cause hypertension. You could be taking steroids that are also known to cause hypertension. There are a whole range of medications that could cause hypertension, and you should always talk to your doctor about side effects of some of the medications that you are taking.